So you hurt your Achilles tendon. Welcome to the club. It's estimated that 6% of the general population will experience this at some point in their lifetime, and 52% of endurance runners will experience this at some point during their running career. So, pretty big club. But that begs the question, why do so many endurance runners sustain this injury? To answer that, we need to understand what tendons do in the body and how they get injured. The first thing to understand about tendons is that they are significantly stronger than muscle. And the Achilles tendon is the strongest tendon in the body. It's been estimated that it can withstand the force of 1,100 pounds. That's a lot of pounds. And when we're running, it accounts for 93% of the plantar flexion force. Plantar flexion is essentially just when your foot pushes off the ground, propelling you forward. So every time you run, that Achilles tendon is getting destroyed in a good way, but it's doing a lot. While that tendon is really strong, it does have a capacity for the amount of work that it can do. So over time, if the load that you're putting it under overreaches that capacity, that's when some degeneration might occur. So what do you do when your tendon gets injured? Well, first, you have to pick the right treatment. And to do that, you need to differentiate between two things. First, is it a tendinitis or a tendinopathy? Tendinitis refers to an acute injury, where the tendon itself became swollen or inflamed because of a quick spike in training volume. Like if you never run more than 3 miles in your life and then decide one day that you want to go run a marathon, you might catch the itis. Whereas tendinopathy is more of a chronic change over time. So this is not inflammatory. This is an actual changing of the structure of that tendon. The main treatment focus of tendinitis is reducing the inflammation. So that could be taking anti-inflammatories, staying off of it for a bit, letting it rest, doing some activity, but really giving that tendon a chance to get some of that inflammation out. The main focus of tendinopathy, on the other hand, is repairing the tendon, because the tendon itself it's all whacked up. But how do tendons repair themselves? If you take 3 words from this video, I want you to remember this. Tendons love load. Here's a chart showing how much load each of these exercises put through the Achilles tendon. So what I will do with my patients is find their starting point with which exercises they can do with a tolerable amount of pain during the exercise and pain that does not last more than 24 hours after the exercise. That's another really important concept to understand, that it is okay and actually good that you feel a little bit of pain during an exercise as long as that pain doesn't go above a 5 out of 10. And as long as the pain is gone within 24 hours after the exercise, whatever you just did, perfect. Keep doing that until you can go up to the next tier. Geez, this is a long one. I'm sorry. The second distinguishing factor for treatment coming up in part 2. It's not as long, I promise.